Good afternoon, everyone, and thank you very much for joining us today. My name's Deborah Garlick from Henpicked, henpicked.net, Henpicked Menopause in the Workplace and author of the book Menopause, The Change for the Better. And today's session is all about menopause and periods, problems with periods. We get a lot of questions around this in our training workshops. And I'm delighted to welcome Dr. Morton to us again, a consultant, obstetrician and gynaecologist, and of course from the fabulous Dr. Mortons. So welcome, Karen, how are you?
I'm very well indeed, thank you. I told you a moment ago that I'm in my scrubs. I'm afraid I've just delivered some twins. I was a little bit worried I would be a bit late, so I'm very pleased to be on time.
Wow, now that's stress, isn't it, for an afternoon? And well, thank you very much for joining us. And we're going to jump straight in because we do get a lot of questions around changes in our periods during the menopause transition, which happens over many, many years. So we're going to ask as many of those questions as we can today. So please do ask any questions that you have for Dr. Morton. And I'm going to jump straight in, Karen, and say, what is actually normal with periods? We all anticipate and we're all told about our 28-day cycle, but actually, what is normal for periods?
Well, of course, everything in nature has a sort of average around a sort of bell-shaped curve around an average. And you say 28 days, well, 28 days is an average length cycle, but some women will have a 21-day cycle all their lives, and others may have a 35-day cycle all their lives. It's like either being medium height, short, or very tall. Everything has a mean, an average. In terms of the amount of blood that you lose, that also is very variable. Most people will lose about, if you were to measure it, about 80 mils of blood in a period, but some people's period will just be a few spots of blood, and some women's will be a deluge. Now, of course, if it's a deluge, it's worth investigating in case there is an underlying cause for the deluge. Right. The same way as if periods are more spaced out, it might be worth investigating in case there is a reason for that. And sometimes you'll find a reason and sometimes you won't. But the important physiological thing to be absolutely clear in your mind about is that it is egg production that regulates the cycle. Right. When you make an egg, the area where the egg came from swells and makes progesterone. And it's when we don't conceive that area on the ovary that is making progesterone realizes there is no pregnancy. The progesterone level falls and we get a period. So if you're having regular periods, you may depend that you are making eggs rhythmically.
Okay, so this is a unique experience. So when we say 28 days, it's more about understanding what's right for you.
Correct. And of course, most youngsters these days have a menstrual app, which is fine. It's fine. And so they're learning about themselves. They're learning about how their normal physiological ovarian function works. The fixed interval is from egg production to menstruation, and that is 14 days. So of course, if you have a 28-day cycle, it's day 14. If you have a 21-day cycle, it's day 7 or 8. If you have a 35-day cycle, you ovulate on day 21.
Right, okay. So you mentioned progesterone, which is of course a hormone that we women generate or produce. So during the menopause transition, why do our periods change?
Well, I often say to women that I see as many 16-year-olds as I do 26, 36-year-olds, as I do 46-year-olds who are having heavy periods. So a lot of women think if their periods are getting heavier, it's because they are approaching menopause. And usually that is not true. Okay. The thing that does happen as we get towards menopause, when the eggs are becoming depleted, is we don't ovulate as predictably. And that's why we miss a period. If you don't make an egg, you don't have a period. And what tends to happen then is the endometrium, the womb lining, stimulated by estrogen, which is still being produced, gets thicker and thicker and thicker. And then when they do get a period after a longer gap, it will tend to be heavier. So really, perimenopause, on the whole, is indicated as far as periods go by the loss of the rhythm, the loss of rhythmic egg production leading to the loss of menstrual rhythm.
Right, okay. So you've got this rhythm going, and is that different for us all? Because I know if I look at my experience, I was actually a 28-dayer. It was, pretty much absolutely accurate to every fourth Saturday morning, essentially. And then when I went into my perimenopause, they were still quite rhythmic. Until one day I went through a very short period of flooding, and then they switched off. Switched off for 11 months, and then I had a final one.
Yes.
But that is, everybody's experience may be completely different to that.
Yes, definitely. So the commonest pattern will be that women start to miss periods, or that they come late. But some ladies, they will have regular periods and then they just stopped and they never had another. Sometimes they'll stop for up to 6 months or so, and then they may resume for another few months. And as you described, not infrequently, the ovaries might give a final burst of activity, and you may have one up to a year later.
Right. Okay. So this brings me on to, because I knew what my rhythm was. So, I knew there was something different going on. And I did do a couple of pregnancy tests, actually, just to think,
yes.
Really? Could I be pregnant? Both negative. But it does beg the question, at what point do you say something's not right? I need to get this checked out. What might any signs and signals that something's not, you need to get some professional medical support?
Okay, well, there are two aspects to the question, really. One is, I'll use the word disease. Have I got something there that shouldn't be there? Have I got something to worry about? Have I got a polyp? Have I got something worse? Have I got some fibroids? Have I got something that's not right? Okay. And then the second is to do with quality of life and general health. If a woman is having very heavy periods, then of course that's going to be sapping her energy and her resources, and indeed making life just a bit miserable. Why would you put up with a period that's so heavy that you can't swim, or you can't wear clothes you want to wear? Even if the period is not making you anemic, which it might, of course, it is still it taps your energy, because you're having to replace all the blood you lose has got to be replaced. So your bone marrow, which is situated in your sternum, your breastbone, and your hips, they are like factories. Those factories are making blood all the time. And if you're losing a lot of blood, you've got to replace it. And factories need energy, electricity, energy. They need a substrate. They need something to make the blood from. So they need iron, folic acid, vitamin B12. They're all the components that are necessary for the factory to be making hemoglobin, to be making red blood cells. And that is a drain on women's resources. So back to your question, at what point should a woman go and seek help? Well, to be honest, I would say the same to any woman, whether she is 16, 26, 36, or 46, or 56. I would say if your periods are sufficiently heavy that they're stopping you doing things you want to do, that you're feeling tired, that you're feeling drained, don't put up with it. Women are such putter-uppers, and a lot of women have said to me over the years, when they come with their heavy periods at 46 years old. I just thought this was the menopause. I thought this was how this is how it's going to be. And they just don't need to put up with that. So that's the quality of life question and the drain on resources question. But then the supplementary part to your question was, when do I need to be worried about it? Okay. And certainly bleeding that is occurring with a loss of pattern, protracted bleeding. A lot of women will still use the word period when actually what they really mean is bleeding. So I saw a lady yesterday, at 46 as it happens, and she had bled for 36 days and she called it a period. Wow. Now, that is not a period. That is just bleeding. And when you've got protracted bleeding like that, you have to ask yourself, is there something going on inside the uterus? It may be in the end that it's attributable to loss of rhythm, loss of cyclical progesterone production, but you can't know that for sure until you have investigated it. So women who've got protracted bleeding or have developed just bleeding that comes randomly in between periods, they need investigation. They need to have a scan. They need to be seen by a gynaecologist. They may need a biopsy of the lining of the womb. And then a plan can be made based on the results.
And you mentioned disease. Is that a possibility? Was it polyps that you mentioned earlier?
Yes, the word disease, I use it sort of in quotes. I'm not suggesting that it's a cancer, but it's not impossible. The lining of the womb can develop precancerous abnormality, the same as the cervix can. Women are all familiar with having smear tests to detect precancerous cell-shaped change. It's a progression. Most women aren't familiar with the idea that there is an equivalent inside the uterus. It's called endometrial hyperplasia, overactivity. And within the spectrum of hyperplasia, there can be overactivity with cells starting to look a bit odd, or with cells looking very odd, but we don't want to call it a cancer yet.
Okay. So lots of reasons to get to the bottom of something if you think this is not normal for me.
Yes.
Get it checked out and to put your mind at rest. And those triggers might be, the fact that it's going on for so long that it could be affecting you from an anemia perspective, or if it's getting in the way of your life, or if it just feels something just doesn't feel right. Get it checked out so that you're actually aware. Because I'll move on to what can you do? What are your options? Because I mentioned flooding earlier, and thankfully for me, I can only think of 2 incidents, because the thing that people don't realize about flooding when you're not expecting it is you do feel very embarrassed.
Yes.
I know one of them, I was actually in a board meeting and I was thinking, oh my goodness, is this going through to the chair?
Yeah.
And fortunately it only happened a couple of times and then it was more or less gone. But some women talk about their regular flooding. And it can really chip away at your confidence if you think, am I prepared for today? Have I got everything I need in my handbag just in case? Some people talk about changing the clothes and needing to have a shower. So, if you're in that situation, what could you do that would make a difference to your overall experience?
Okay, well, the first thing that you must absolutely seek expert advice. And when I see women, I say, my first brief is to exclude disease. Again, I use that word because is there something there that's causing the problem? A polyp, some fibroids, the womb lining having gone a bit peculiar. Is there something that we should be doing something about because we've got a diagnosis? Or have we got a nuisance? And so my second brief is to improve quality of life if I can. So my first job is to exclude the underlying cause. And it may be that there's a fibroid, a little thing inside the inside of the womb that I can put a telescope in and just chip it away. And that's the end of the problem. A simple thing. But there are lots of other things that can be done. Probably the most popular these days would be to have a Mirena fitted.
A Mirena, is that a Mirena coil?
Yes, well, now it's interesting, you use the word coil, and of course women all say the word coil, but there isn't any coiling about it. The word coil came about when people had a copper coil, which did have literally a coil of copper around it. But so we call it a Mirena intrauterine system. It's a delivery system, incredibly clever delivery system, which you pop it inside the uterus and it releases from its stem a tiny amount of a synthetic progesterone every day into the womb, telling the womb lining to ignore what the ovaries are doing. Very, very popular as a method of contraception, but designed in Finland as a treatment for heavy periods. I don't know why, I don't know about you, Deborah, but if I think about something that's come from Scandinavia, I think it must be jolly healthy. I have great empathy with Sweden, and I feel healthier when I get off a plane in Gothenburg, or I don't know about you. So I think it's instinctively a very healthy thing. I like the fact that this was designed in Finland. Anyway.
And how long does that stay in for? I mean, you know, is it because clearly it's a procedure?
Yes, very small procedure. Very small procedure, and it lasts for 5 years. Now, many women will come to menopause, come to the point at which they develop symptoms of declining ovarian function. Just take hot flushes, just as an example, with an in-date Mirena in their uterus. And that's a real quids-in situation to be in, not because the Mirena is hormone replacement therapy. It is not, but it is a facilitator for estrogen replacement therapy.
Right.
The vast majority of women, it will stop their periods altogether. The vast majority, not everybody, but the vast majority. So of course, women can't then use a change in menstrual pattern as an indicator to them as to whether they're getting to the point where their ovaries are declining.
Right, I'll come back to that one. So
yeah, no, that's fine.
Is one solution, but you mentioned progesterone there, and sometimes we have people saying around hormone replacement therapy, HRT.
Yes.
And they'll say, my GP has told me that I can't have it until my periods stop. Is that true or false?
That's totally and utterly false. So another approach to irregular, troublesome periods, once disease, well, big word, I know, has been excluded, is to take a cyclical combined HRT regime, just the same as a 16-year-old with troublesome periods would go onto a pill, might go onto a contraceptive pill, to give rhythm, so to regulate and moderate the periods.
Right.
So when women are having those irregular periods, and because there's a big gap, a 2-month gap, they're heavier and more troublesome. They would be ideally suited to taking a cyclical combined HRT regime as a treatment for their periods.
Okay, so not everybody will choose HRT as their preferred method of managing symptoms, but if you're having problem periods, that might be another reason why you might want to consider it.
Absolutely. Another option, all patient choice, women should be presented with all of the various choices. Another choice might be to have the lining of the womb cooked. Now, cooked. So the proper term for that is an endometrial ablation, destroying the womb lining down to just deeper than the growing layer. There are various ways of doing it. Most people will use a system called the NovaSure, which is like a little probe put inside the womb and expanded, and then heat is applied to it so that it cooks to a certain depth, to a few millimeters deeper than the layer that is growing under the influence of the hormones. So it's a very good treatment for heavy periods.
Okay, now I have to say I felt a bit ouch when you were talking about the Mirena, but you capped it with the ablation. So, but so there are options, and
Definitely.
for so many people, it might be, I think I was quite lucky that I only had it for this period of time.
Mm,
Now I'm period free, and that is just absolutely wonderful.
yeah.
That's what we're looking for. But one of the things that you started to go on to there was a question that we get a lot. When we talk about the definition of menopause, we talk about menopause being the one day in time when you can look back and you've not had a period for 12 months.
Yep.
Day is classed as your menopause. Now,
Yes.
with a Mirena or with the contraceptive pill, then that marker, if you like, is missing.
You're
So
right.
a question that we have that says, how do I know where I am on the menopause transition? Often I think that question is, have I been through it yet, or have I got
Yes.
this to look forward to? Or
Yes.
what would you say to somebody that
Okay.
is
Well, going back to that average curve, of course, the vast majority of women will get hot flushes. Just take the hot flushes. The vast, vast majority. Some ladies will not get a hot flush in their lives. So a woman might come to see me, aged 50, 51, whatever, because her Mirena is now out of date. And she wants to know, what should she do? If she has it taken out, would she go back to having periods? What should she do? Well, in those women, it's absolutely perfectly fine to have a blood test to measure the level of the driving hormone from the pituitary gland, the master gland behind the bridge of your nose, which makes the hormones that drive the ovaries. And if the FSH, the follicular stimulating hormone, is very high, then you may depend that she actually is past the menopause. You'd probably leave the Mirena in place for another year just to be absolutely sure. And that would be the end of that. Of course, that woman may be thinking, even though I haven't had hot flushes, what shall I be doing to secure good health for the next half of my life? And so just because she isn't having hot flushes doesn't mean to say that she shouldn't be reading about it. Your book's great. Thinking about it, trying to decide what her personal philosophy is on the management, her self-care for the next half of her life. Just because she hasn't got hot flushes doesn't mean that she might not want to or need to take care of her bones. It may be her mother had osteoporosis, and so that would be something that she would put into her equation. So those women who are very familiar with a Mirena, they may decide to have it changed even though they no longer need it for contraception.
Absolutely. So often what we hear from women is, oh, I'll have my Mirena taken out, and if I get my periods back, then I've not gone through it, or if I'm not, but I can see that you're wincing at me, because I know we have had women saying, I wish I hadn't had it taken out.
Yes, definitely.
So, and some people saying, I can't get a blood test for it, so do I keep it in or do we keep it out? And you're saying
you can get a blood test. The same applies, Deborah, to a progesterone-only pill. There won't be many women who'd be taking a combined pill at that point in their lives. On the whole, if they're on an oral contraceptive, it will be a progesterone-only pill, and that won't mask ovarian function. You could have the same blood test as you would with the Mirena. You can't have a blood test if you're on a combined pill, because it actually suppresses, it is estrogen, synthetic estrogen. So it suppresses ovarian function and would keep the FSH low. So you can't have a blood test if you're on a combined pill, but you can if you've got a Mirena or you're on a progesterone-only pill.
Oh, that's really interesting. One little question I've got, my colleague Sarah is going to join me in a moment for some questions. But when we were talking earlier about triggers, and what you mentioned was that you might miss some and then have one just before the year. What about individuals where their periods have stopped for some time and then suddenly they have a bleed?
Well, if it's more than a year after the last period, then you must be referred. And in fact, you would be referred under what would be called the 2-week rule, because it could be something unpleasant. But analysis of the story is always the most important thing. I will often see women who 13 months after their last period, they had a bit of breast tenderness, their hot flushes remarkably stopped, and they thought, oh, I'm through the menopause now, I'm not going to get any more hot flushes. And then the breast tenderness got a bit worse, then it subsided, and blow me down, they got a period. Now, Deborah, I happen to know that your daughter is getting married on Friday.
Yes.
And I can tell you that I have seen so many of these little bursts of ovarian activity when there's been an emotional event, the birth of a grandchild, a daughter getting married, something like that. And so, yes, it needs to be investigated, but it may well be it started like a period, it felt like a period, it stopped like a period, and actually it was a period. But you can't know that until you've excluded other things.
Wonderful. Thank you very much. And Sarah, welcome.
Thank you.
And how are the questions going in the background?
Yeah, we've got some great questions that have come in, Karen, and thank you so much for what you've shared so far. There's a number of personal questions, but I'll pop in if you wouldn't mind, Karen, some of the generic questions that have been asked. So somebody's saying about HRT, we've spoken about that, and they've said, how will they know when their periods stop, as the HRT is still causing them to have periods, and they're rather confused as to, when will they stop? I appreciate this could be a tricky one to answer without knowing the full medical history of this individual.
No, it's fine. It's fine. Sorry, it's actually exactly the same question in a way as if somebody were unusually taking a combined pill. So we've got a woman who her periods are troublesome and a bit irregular, so she goes on to a combined cyclical HRT regime. Well, there isn't a way of knowing. You'd have to stop it and see. But if they've become irregular, say at 49, so you go onto the pill, you could be pretty sure, not totally, but pretty sure that it would all be over by 2 years after that. And at that point, if that woman still wants to take hormone replacement therapy, it would be a reasonable thing at that point to change to a continuous combined, not a cyclical regime. But you can't be certain that she's gone past the time when she would have her last period. But it's statistically, if she's got menstrual irregularity, by 2 years, she's going to be past it.
Brilliant, thank you. And a number of questions have come in regarding Mirena coils, and someone's just saying, they tried to have a Mirena coil, they hadn't had children, it didn't work for them, and they've had to come off the pill now because they've literally had so many migraines. So again, that's, individual circumstances for that individual.
Yes, no, sure. It would be unusual for a progesterone-only pill to produce migraine. The association with migraine is really with the synthetic estrogen in the combined pill. So I would definitely recommend that people use a progesterone-only pill. After 40, most women will use a progesterone-only pill. Mm-hmm. I understand that the lady you're talking about, if the Mirena didn't go in easily, but it's very rare not to be able to put it in with some local anaesthetic, even in a lady who's not born children. Mm-hmm. Mm-hmm. Maybe the person who was trying to put it in for her wasn't overly experienced.
Yeah.
So worth another try, is that?
Maybe worth another try. Yeah, maybe worth another try.
Yeah. You mentioned earlier, Dr. Karen, about vitamin B12 being helpful, and someone's asked the question here, are supplements like omega-3, vitamin D and magnesium, will they all help and work to regulate periods?
No, they won't help to regulate periods. They're important things for general health, but they don't give any rhythm to periods at all.
Okay.
And Sarah, may I ask this one, because I think this follows on. I have a Mirena and very regular light periods, but I'm suffering with various perimenopause symptoms. Now you mentioned, I was going to pick up on it again, that the Mirena has progesterone.
Yeah.
So can estrogen be used alongside the Mirena?
Yes, it absolutely can. It's a little bit more difficult if it hasn't made the periods go away completely. About 90% of women, it will stop periods completely. So it may be that the lady in question would need to take some estrogen in a cyclical way to tie in with the way her bleeding is happening. Otherwise, she might end up with a sort of bleeding muddle, which would be, which would be a nuisance.
Yeah,
Thank you.
thank you. And going back to another question related to HRT, and this time patches. Somebody said here they haven't had a period since January. They've gone on to HRT patches. Their doctor said they would start again. They've had a period, and as soon as they put on their first patch, and just really wanting some assurance to know, is this normal?
Well, haven't had a period since January. We're only July. And so it was correct. I hope that this lady was prescribed a cyclical regime. I would never prescribe a no bleed, continuous combined, the same in every, whatever you're taking, every day, same every day, unless you were a year after the last period. So I hope that this lady has been prescribed, if she's been given a patch, she should have been given Everell's Sequi, which has got 4 patches with just estrogen and 4 patches with estrogen and progestogen. Now, of course, it might have been just by chance that she started a period when she started the patch. The patch won't have provoked a bleed, not the first patch. I hope she's got a cyclical regime.
May I ask this one, Sarah? Because you've spoken about heavy periods, and we did quite a lot. But what about lighter periods and spotting in between periods?
Well, spotting in between periods is bleeding in between periods, and it requires investigation. There's no doubt about that. It needs to be investigated.
Right, okay, thank you. Sorry, Sarah, I think we have time for one more.
Yeah, I think this one again relates to heavy, painful periods. This individual is saying that even though they're on the HRT combined pill and they are having heavy, painful periods, should they get this checked out, because it really is quite painful?
Yes, definitely, and they should not put up with that. And that lady might be better suited to a Mirena in the uterus, and estrogen just through the bloodstream. Or it's not impossible, of course, if somebody's continued to have cycles, that endometriosis might be a component of the story. So she needs to be investigated. And
not be a putter-upper, as you said.
Not be a putter-upper, my favorite, my father's expression.
I love that. Thank you.
Absolutely. Well, I'll send these questions on. So thank you, everyone, for giving us your questions today. And we will check through and see if there's any that we've missed that we can include, because we always follow up the notes after the session and send those on as well. And thank you very much, Sarah, for looking after the questions, and wonderful to see you again, Dr. Karen Morton.
Lovely to see you, Deborah.
Look forward to seeing you again. And there is one question, and I think we should end on this one, because Dr. Morton came rushing here today, having just delivered twins. So we did have a call on whether she was going to be able to get to the webinar in time. But is 44 too old to have a baby, or is it too late?
No, the lady I delivered this morning was 43.
There you go. Thank you very much. Have a wonderful week, everyone, and
a wonderful wedding, Deborah.
Thank you very much. All the best.
Bye-bye.
Bye.